Hi, I'm Susan Sloan with Real Health Quotes. Medicare. Are you about to turn age 65? Or are you about to go on Medicare because of disability? There's certain rules that apply. They are different depending on your situation. If you are turning 65 and you have individual and family insurance, you need to go on Medicare You need to take Medicare Part A, which you get automatically, and you also need to take Medicare Part B. Individual and family insurance stops being sold at age 64 or age 64 and a half. You cannot remain on that policy. If you are part of a small employer group and there's less than 20 employees, you must take Medicare Part B. Whether you plan to stay with the group insurance or not, you must take Medicare Part B. Otherwise, you will face a penalty and have to wait later on in order to get Medicare. You can still stay on your employer's insurance, but you're then going to have to figure whatever your Medicare Part B cost is going to be. It could be $134. It could be more than that, depending on your income, if you're still continuing to work. You also have to figure in the cost of a prescription drug plan. That runs anywhere from about $12.60 a month up to $150, entirely dependent on the prescriptions you're on. If you are part of a large employer group, 20 or more employees, you do not need to take Medicare Part B. You can delay that. Medicare Part A you get automatically as long as you've worked 10 years in your lifetime. And basically what will happen in a large employer group, the employer's insurance is primary, and then your Medicare would be secondary, the Part A would be secondary, and that's the inpatient hospitalization and facility charges. Medicare Part B, you do not want to take that until you are going to be going on to Medicare. Otherwise, you will end up with penalties on prescription drug, and you could end up, and you're paying for things that just are not going to be used if you take Medicare Part B, and you could end up not being able to get a Medicare supplement plan of your choice, because there is medical underwriting that takes place if you are not in your initial election period or have a special election period. So be careful on that. The best time to talk to me about it is 4 or 5 months out before you're ready to go on Medicare. If you're going on because of Medicare disability, again, let's sit down and talk about it. Don't wait till the last minute. It is really important that we look at your options and what you can afford and what will work best for you. And you really have to factor in the cost of whichever coverage you get, a Medicare supplement or a Medicare Advantage plan. And if you get a supplement, we have to look at the cost of the prescription drug plan as well as your Part B premium. I'm Susan Sloan from Real Health Quotes. Feel free to get in touch with me anytime. Thank you so much, and I hope you have a great day.